Hey everyone, today I'm diving into a topic that's more relevant and more urgent than ever, the opioid epidemic. You might remember hearing a lot about it a few years ago, but I have to tell you, it's only gotten worse. Buckle up, because this is a deep dive into the growing catastrophe of the opioid crisis. First off, let's talk about the impact on one of the most vulnerable groups, pregnant and postpartum individuals. In Colorado, accidental overdoses are now a leading cause of death for this group. Imagine that. Ashley Miller's story is a heartbreaking example. She lost custody of her twins after a traumatic birth, all while battling substance use. But there's a beacon of hope in places like Aspen Miracle Center, where she found support and eventually regained custody. This shows how crucial accessible treatment and support services are for these individuals. But it's not just about individual stories. The maternal mortality rate in Colorado is rising, and it's a national trend. Especially in marginalized communities, there's a dire need for equitable healthcare access. Initiatives like Maternal Overdose Matters Plus aim to address these disparities, offering specialized care to pregnant and postpartum individuals struggling with substance use. We need more of this, and we need it now. Now, let's shift to Dallas County, where the situation is dire. Overdose deaths have skyrocketed, and there's a severe lack of rehabilitation facilities. Fentanyl, a potent synthetic opioid, is flooding the streets, often mixed with other substances. It's a ticking time bomb. And if that wasn't enough, the animal tranquilizer xylazine is showing up in overdose cases, making the situation even more lethal. What's worse? The scarcity of rehabilitation resources. This is particularly troubling for adolescents and Spanish-speaking residents who need culturally sensitive and age-appropriate treatment options. Community forums and advocacy groups are rallying, but the call for increased funding and resources is immediate and pressing. The opioid crisis has also been exacerbated by the pandemic. Researchers at Massachusetts General Hospital and Harvard Medical School have been studying this, and their findings are both alarming and hopeful. They suggest that a combination of readily available treatments for opioid use disorder, increased access to naloxone, the overdose reversal drug, and reduced overprescription of opioids could significantly reduce overdose deaths. But here's the catch. We need large-scale implementation. States like New York, Massachusetts, Kentucky, and Ohio are heavily affected and need these interventions urgently. The researchers emphasize addressing the underlying mental health crisis often associated with substance use. Expanding mental health services and tackling socioeconomic factors are key to supporting individuals struggling with addiction. In conclusion, combating the opioid epidemic requires sustained and comprehensive public health efforts. This means increasing funding for research, expanding access to treatment, and addressing social determinants of health. By prioritizing prevention, treatment, and support, we can work towards mitigating the devastating consequences of this crisis. Thanks for tuning in. Remember, the opioid epidemic is far from over. Stay informed, stay safe, and let's push for the changes we so desperately need. Trending news now.